Good morning.
Morning.
How are you?
Not feeling so well.
Okay. My name is Fatima and I'm the nurse for the day. Can you please just identify yourself?
Joel Fanjo.
Okay, Joelle. Can you tell me what brings you to the hospital today and why aren't you feeling so well?
Okay, right. So I've been feeling cold lately a lot. Also I've noticed that I've gained weight a lot more than I'm supposed to. Although I've kept the same diet and everything. Also, I'm always tired and I feel depressed. My skin is kind of dry. So,
Okay.
and also I have like muscle cramps.
Okay, Joelle. I will be performing physical assessment and the doctor will be with you shortly to determine what lab tests you will need.
Good morning.
Morning.
Yeah, my name is Mark. I am the doctor for today. And what's your name?
Joel Fanjo.
Okay, Joel. And after doing some extensive blood tests, we did one test that was definitive for your condition, and we tested your blood for your thyroid hormone. And we found that it has, the blood test is called a TSH test, thyroid stimulating hormone test. It showed some elevated levels of thyroid stimulating hormone, which means that you have very low levels of the thyroid hormone. So the condition that now you have is called hypothyroidism, and it's a milder form. It was progressing towards moderate and could be severe. So we are gonna prescribe to you a medication called Levothyroxine. It's also called Synthroid. So it's actually a synthetic form of the thyroid hormone. So this medication works by increasing your metabolic rate. It increases your body temperature, your blood volume. It also increases your cardiac output, and it increases the body's oxygen consumption. And it effects its changes by controlling the protein synthesis in the body, and it increases the growth and development at the cellular level by its effect on the thyroid hormone receptors on the cell. So I'm going to prescribe an oral form of the medication. Normally we give it by the oral route or by injection, intramuscular or by intravenous route. So you're supposed to take a tablet of 100 micrograms per day every morning. Take it on an empty stomach with water, and take it at the same time every day. And you should do this 30 minutes to 1 hour before taking any medication. So if you have any over-the-counter medication, always check the levels to make sure that they don't have iodine, so that you have proper working of this medication. This medication is not a cure, so you'll be taking this as a lifelong treatment for your condition, and you should never stop taking this medication. And if there's anything, please make sure that you contact the prescriber. The nurse will be able to give you more information about this medication. Okay?
Hello, Joelle. This is Michelle, and she's a student nurse. She will be joining us this morning.
Good morning.
Now I'll be mentioning some contraindications of the medication. Levothyroxine is contraindicated in patients with thyroid toxicosis, acute myocardial infarction, and uncorrected adrenal insufficiency. Levothyroxine should be administered with extreme caution to patients with cardiovascular disorders. It is pregnancy category A and should not be discontinued during pregnancy. Consumption of certain foods may affect levothyroxine absorption, such as soybean flour, cottonseed meal, walnuts, and dietary fiber may bind and decrease the absorption of levothyroxine from the GI tract. Joelle, I will be just telling you how to use the medication. Make sure to take the medication in the morning before breakfast and any other medications. It is important to take the medication at the same time each day. If you miss a dose, then take it as soon as possible. However, if it's 2 to 3 doses, please contact the physician. Take your pulse before taking the medication and withhold it if your resting pulse is over 100 beats per minute. Monitor your weight weekly and report back of any weight gain. If you are diabetic, increase self-monitoring of blood glucose. Levothyroxine does not cure hypothyroidism. It just provides a thyroid hormone replacement, and it is a lifelong therapy. I would like to remind you not to change the brand name unless prescribed by the physician.
So I'll be talking to you about the pharmacokinetics. That's the movement of the drug throughout your body. Okay. So at first, for the absorption, as the nurse stated, that with the absorption in the GI tract is actually between 50 to 80% that is absorbed of the levothyroxine. Full effects don't occur for 1 to 3 weeks after oral therapy begins, and if you're administering it through intramuscularly, then that absorption is variable and poor. And for the distribution part, distribution isn't fully described in the levothyroxine. However, most drugs is distributed into most of the body tissue and fluids. The highest level are found in the liver and kidneys, and 99% is protein bound. For metabolism, it is metabolized in the peripheral tissues, primarily in the liver, and liver, kidneys, and intestines. About 85% of metabolized levothyroxine is deiodinated. The excretion part of it is that for fecal excretion, it is eliminated 20 to 40% of levothyroxine. Half-life is 6 to 7 days. Okay.
Okay. Do you have any questions to ask?
So I just want to confirm the side effects. That can be anxiety, insomnia, tremors, headache, and fever. And also, like, I can see like some weight loss, because I want to know, as I've been gaining a lot of weight, so weight loss can be one of the side effects.
Yes.
Okay, so also like the life-threatening side effects. So I have to contact my doctor if I have like chest pain, angina, or I also know you also said it can cause a cardiac arrest.
Yes.
That's
Alright.
correct. And I just would like to remind you, Joelle, to go for the yearly checkups to make sure that the effect of the therapy is working. Okay? Have a great day.
All right. Nice meeting you.